Our next guest was struggling with severe pain before learning she could lose arm function if she didn't get help fast. This is Celia's story.
I've always been a very active person, but that all changed once I started having neck and back trouble. The pain started in my neck area, radiating down my shoulder, eventually down my right arm, causing numbing in my whole hand. For the past 7 years, I've had cortisone shots, steroids, chiropractic care, but it's consistently gotten worse to the point where it would wake me up out of my sleep. I ended up seeing a specialist, and I was diagnosed with herniated disc in my cervical spine. I was told that I needed to have surgery because the weakness in my arm was progressing so quickly that they were concerned that I would lose complete use of my right arm, which terrified me.
It's scary to think, losing my arm. It's very scary.
Today we're going to be performing a minimally invasive microsurgery from the back of the neck, remove a disc fragment that's compressing the nerve. We're doing an x-ray because I want to make sure we're centered exactly to make the appropriate incision. We count the vertebrae, 1, 2, 3, 4, 5, 6, 7. Everybody agree? All right, here we go. The critical part of what we're doing today is working in a very tight space right around the nerve and the spinal cord, which makes the operation technically very challenging. First thing we're going to do, make a small incision, less than an inch. We're just cleaning out the soft tissue where we need to be. Now we put the retractor in to get better visualization. Now we're going to drill to get in there. We're very, very careful because, if you drill too fast, you can drill the nerve. You don't want to go too far up this way because that's where the vertebral artery is sitting. If you do that, the patient can have a stroke. You got to work very, very carefully here because we're about 1 millimeter away from the spinal cord. That's the nerve right there. And see the white thing? That's the herniated disc right here. It's coming out. Big piece, it's about 1/2 inch. That was what was giving her the weakness and the pain. There's another fragment right there. And now it feels really good, actually. Everything is actually looking very nice now. We're done. I think she's going to do very well. Hopefully she can get back to her athletic activities and resume life. And in a few months, this would be just a bad dream. That's gone.